Chapter 20 study guide questions. So let me get that pulled up. Okay, can everyone see my screen?
Yes.
Okay, and are we doing odds or even for chapter 20?
Evens.
Okay. All right, and my internet is running a little slow, so bear with me. All right, evens. 2 is false. 4 is false. 6 is false. 8 is true. 10 is false. 2 is true. 4 is true. 6 is true. 8 is false. And 10 is false. 2D, 4K, 6L, 8A, 10E, 12M. Number 2, ingestion of food substances and their use for energy, growth, reproduction, and excretion. 4, under conditions favorable to the pathogens, they grow and multiply. The body tries to stop the invasion. If the body is successful, the pathogens are destroyed, and the individual experiences no ill effects. If the pathogen is able to overcome the body's natural defense mechanisms, an infectious disease results. Number 6, inflammation, phagocytosis by the white blood cells and the production of antibodies. 8, contagious individuals should cover their mouth and noses while coughing and sneezing. I pray everybody does that anyways. A short period in which first symptoms that indicate an approaching disease occur. 12, wait, did I read 10? All right, 12, boils, carbuncles, pimples, impetigo, abscesses, staphylococcal, food poisoning, wound infections. Botulism, tetanus, gas, gangrene, gastroenteritis produced by salmonella food poisoning, typhoid fever, pertussis, bacillary dysentery, diphtheria, leprosy, and plague. 16, influenza, chickenpox, rubella, mumps, poliomyelitis, smallpox, rabies, herpes simplex, herpes zoster, yellow fever, hepatitis, and most of the infectious disease of the upper respiratory tract, including the common cold. Power, used for the initial focusing and light adjustment of the microscope, also used for the initial observation and scanning requirements needed for most microscopic work. High power, used for more thorough study of specimens, such as observing cells in greater detail. Oil immersion, provides the highest magnification and is used to view very small structures or the detail of larger structures, such as microorganisms and blood cells. Carry the microscope with 2 hands. Place the microscope down gently. Handle the microscope so that the fingers do not come in contact with the lenses. Avoid wearing mascara because it is difficult to remove from the ocular lens. Cover the microscope with a dust cover when it is not in use. Microscope and the nose piece rotated to the low power objective and the body tube adjusted to its lowest position. Clean the enameled surfaces of the microscope with mild soap and water. Clean the metal stage after use with gauze or tissue. Keep the ocular objects and condenser clean while using dry lens paper. Keep the light source clean by polishing with lens paper. Do not attempt to fix a malfunctioning microscope yourself, as it may result in further damage. Rather, contact a qualified service person. 20. Undesirable microorganisms that can enter the specimen in various ways. They grow and multiply and possibly obscure and prevent identification of pathogens that might be present. 24. Wear gloves. Not eat, drink, smoke, or apply makeup when working with microorganisms. Do not lick labels for specimen containers. Cover any break in the skin with a band-aid. 26. Antibiotics may suppress the growth of bacteria, which could lead to a false and negative result. 28. To prevent drying of a microbiologic specimen and preserve it in its original state until it bacterial infection of the back of the throat and tonsils. 32. Severe and sudden sore throat, fever of 101 Fahrenheit or higher, red and swollen tonsils, white patches or streaks on the throat and tonsils, severe pain and difficulty upon swallowing, tender and swollen lymph nodes on the sides of the neck, tiny red spots at the back of the roof of the mouth, and headache. 34. A morbid secondary condition that occurs as a result of a less serious primary infection. 30. They are easy to perform and provide results in a short period of time. 38. Primarily transmitted through droplet infection, transmitted less frequently through indirect. 40. An individual is contagious approximately 24 to 48 hours before the onset of symptoms and up to 5 to 7 days after symptoms appear. Fever and chills, muscle aches and joint pain, sore throat, runny nose, nasal congestion, dry cough, headache, joint pain, anorexia, fatigue, gastrointestinal symptoms such as nausea, vomiting, and diarrhea, more common in children. 44. Viral pneumonia, a worsening of a chronic medical condition and secondary bacterial infections. 46. The vaccine is recommended for all individuals and older. 48. Protects against the flu, reduces the severity of symptoms, and decreases the risk of complication. 50. Increase fluid intake to stay hydrated, avoid the use of alcohol and tobacco, and take over-the-counter medications to relieve the symptoms of the disease. 52. They are recommended primarily for unvaccinated individuals who are at risk for developing complications from influenza. 54. For a patient who is at high risk for developing influenza complication as a basis for prescribing medications such as an antiviral drug. 56. A flocked swab results in more swab tip than a cotton tip swab and leads to the removal of a greater number of epithelial cells from the nasal pharynx. 58. To reduce pathogens to grow and multiply. 62. If the pathogen is susceptible to an antibiotic, a clear zone without bacterial growth surrounds the disc. If the pathogen is resistant to the antibiotic, no clear zone is seen around. All right. Okay, so make sure you send me your results for chapter 20. And then we're going to start on chapter 22, page 771. Any questions about anything so far, ladies? Okay. So Miss Alicia, can you please go ahead and read Introduction to Disaster and Emergency Planning?
Every healthcare facility faces the possibility that a disaster or serious emergency may occur, resulting in injuries, loss of life, property damage, and the inability to provide usual service. Medical offices must plan ahead to minimize the damage from any disaster or serious emergency and facilitate recovery so that services can be restored as efficiently as possible. This chapter presents an overview of the various types of disasters and serious emergencies that may affect the medical office, along with the psychological effects that emergency situations can have on an individual. Also presented in this chapter is a discussion of emergency preparedness and protective practice guidelines, including the OSHA requirements for developing an emergency action plan and fire prevention plan.
Very good. All right, categories of disasters. Highlight this paragraph. A disaster is defined as a sudden, adverse event that can cause damage or loss of life. Disasters can be categorized as natural or man-made. Let's see. Jasmine, can you please go ahead and read natural disasters?
A natural disaster is a catastrophic event that is caused by nature or the natural processes of the earth. Examples of natural disasters include floods, tornadoes, hurricanes, earthquakes, tsunamis, blizzards, volcanic eruptions, and epidemics. Natural disasters may cause injuries and loss of life, as well as significant damage to the environment. Natural disasters may occur with or without warning, which allows for some preparation. On the other hand, an earthquake usually occurs without warning. The impact of a natural disaster may be random. For example, the exact strength and path of a hurricane are difficult to predict. This often requires numerous communities to prepare for this type of disaster in the event the hurricane hits their community.
Right. So on natural disasters, you're going to highlight the first two sentences. Let's see. Lily, please read man-made disasters.
A man-made disaster is an event that causes serious damage through intentional or negligent human actions or the failure of man-made systems. Examples of man-made disasters include fire, power outages, bomb explosions, terrorism, structural collapse, radiation accidents, chemical spills, and bioterrorism. The amount of threat or damage from man-made disasters can vary considerably. For example, a fire in a wastebasket is usually quick contained. On the other hand, a hazardous chemical spill may involve an entire city or area. The type of emergency personnel would respond to the man-made disaster depends on the nature of the disaster. Municipal fire department and police department provide rapid assistance for fire, injury, structural collapse, and criminal activity. The National Response Center of the Environment Protection Agency (EPA) responds to the release or potential release of oil, radioactive materials, or hazardous chemicals into the air, land, or water.
Very good. Okay, so you're going to highlight the very first paragraph. All right. Nancy, are you where you can read the psychological effects of serious emergencies?
Yes, ma'am. Whenever an emergency situation occurs that causes serious damage or interpretation of the normal daily routine, individuals react positively and negatively to the loss of property or disruption of service. Positive reactions involve the triggering of resources, both internal and external, to meet the challenges. For example, when a serious flood threatens an area, individuals usually mobilize quickly to fill and place sandbags to minimize the anticipated damage. When physical and emotional resources are depleted, however, individuals react negatively. Disasters that tend to cause the most serious psychological effects include those with the following characteristics: occur without warning, pose a serious threat to personal safety, or unknown health effects, having uncertain duration, such as serious floods in major rivers, result from malicious intent or human error, have symbolic significance, such as the 911 attacks.
All right. Okay, so you're going to highlight where it says positive reactions involve the triggering of resources, both internal and external, to meet the challenges. Highlight the example, which a serious flood threatens an area. Individuals usually mobilize quickly to fill and place sandbags to minimize the anticipated damage. And then you're going to highlight that disasters that tend to cause the most serious psychological effects include those with the following characteristics, and I want you to highlight each bullet point. Okay, so has anybody experienced either a man-made disaster or a natural disaster? That's okay, it's not a bad thing.
Glory to God.
Huh?
I said, glory to God, no.
Good. Good. Yeah. Yep, tornado, big time. So it can be really scary. Okay. And the reason that we are going to go over this chapter is because as a medical assistant, I pray that it never happens, but the possibility of a disaster happening is possible. It's possible anywhere. But as a medical assistant, it's going to be part of your job to help keep your patients and fellow staff members safe, right? You may have to help get people to safety. And we need to know what that disaster looks like. We need to know what we need to do and how we can prepare for that. But we also need to understand that even, if you're a victim of a tornado, it can have some lingering effects. And for sometimes more so than others for some. I mean, it just depends on that person. So we need to be able to know how to do that. We need to be able to know how our body responds to stress, to these disaster events, like what happens inside of our body. So that's what this chapter is kind of going to go over, okay? So we're going to start now on the stress response. Does anybody have any questions about anything so far? Okay, very good. All right, Miss Natalie, can you please read the stress response, that one paragraph, please?
Stress is the body's response to threat or damage. When a disaster or serious emergency occurs, individuals who are affected by it frequently experience stress. Hans Sally was an Austrian physician who practiced medicine in the middle of the 20th century. Sally described the body's reaction to stress as a three-part general adaptation syndrome, GAS, which is illustrated in figure 22.4. The three stages of GAS are the alarm phase, the resistance phase, and the recovery or exhaustion phase.
Very good. Okay, so I want you to highlight the first sentence where it says stress is the body's response to threat or change. And then highlight where Silly described the body's reaction to stress as a three-part general adaptation from GAS, not to be mistaken for the other GAS. All right, very good. Alarm phase. Sabrina, can you please read alarm phase?
This alarm phase is often called the fight or flight response. In this phase, the body senses the stressor and begins to react to combat it. Epinephrine is released from the adrenal medulla, which stimulates the sympathetic nervous system, triggering the following changes in the body.
dilation of the pupils, increase in heart rate, increase in respirations and perspiration, and increase in the blood pressure. These changes prepare the body to fight or to run away. In addition, the muscles tense in preparation for action, and the attention becomes narrowly focused on the perceived threat or significant task. This phase does not last very long. In some instances, it may only last a matter of seconds. Some people experience the alarm phase as energizing, whereas quickly become extremely anxious. Example, if you are in a serious fire erupts in the medical office, employees typically experience the alarm phase. The fight or flight response helps employees to remain focused and allows them to quickly and effectively evacuate themselves and others from the burning building and perform other types of rescue duties.
All right, very good. All right, so the fight or flight response. So this is a pretty normal, right? This is the first part of that general adaptation syndrome. So highlight the words fight or flight response. Highlight where it says the body senses a stressor and begins to react to combat it. Epinephrine is released from the adrenal medulla. Highlight triggering the following changes in the body: dilation of the pupils, increase in heart rate, increase in respiration and perspiration, and increase in the blood pressure. Highlight these changes prepare the body to fight or to run away. In addition, the muscles tense in preparation for action, and the attention becomes narrowly focused on the perceived threat or significant task. All right, let's see here. Alicia, can you please read resistance phase?
Okay. The resistance phase begins almost immediately after the alarm phase. In this phase, the stress remains, but the body adapts in an effort to cope with the stressor. The resistance phase may last hours, days, or even months, depending on the circumstances. During this phase, the adrenal cortex secretes cortisol. Cortisol increases the blood glucose level to sustain energy because more energy is required to maintain this stage of resistance than normal state. The body constantly remains on guard and is not in a state of balance, homeostasis, but is able to carry on its normal functions. Individuals may experience a number of stress related symptoms during this phase, such as fatigue, irritability, lethargy, and lapses in concentration. Example, if a medical office employee temporarily becomes trapped by a fire, such as it is described in the earlier example, he or she may be unable to cope with the stress of that experience. In this case, the employee enters the resistance phase and constantly feels on guard but is still unable to function normally. If the resistance phase lasts for an extended period of time, the employee may begin experience stress-related symptoms.
All right, very good. Okay, so you're going to highlight the second and third sentence, and then highlight the word secretes cortisol. Cortisol increases the blood glucose level to sustain energy because more energy is required to maintain the stage of resistance than the normal state. And highlight the body consistently remains on guard. All right, before we go on to page 774, take a quick look at figure 22.4. Highlight general adaptation syndrome, those words. Highlight alarm phase, resistance phase, recovery phase, and exhaustion phase. All right, Jasmine, can you please read recovery or exhaustion phase?
If the stress is removed, the body enters the recovery phase. However, if the stress continues, the body's ability to resist stress is lost and the individual enters the exhaustion phase. A recovery phase. In the recovery phase, the stress has been removed and the parasympathetic nervous system begins to regain control. Eventually, the body returns to its normal level of function, homeostasis. B exhaustion phase. If stress is chronic and excessive, the body's resources to combat it become depleted. Eventually, the immune system is compromised and the individual becomes more susceptible to a variety of illnesses ranging all the way from colds and flu to cancer. Example, if the employee learns to cope with the stress of being trapped in the fire, the body enters the recovery phase and returns to a normal level of functioning. If the employee is unable to cope, the stress becomes chronic and he or she will enter the exhaustion phase and begin to experience stress-related illnesses. Figure 22.5.
Very good. Okay. So I just want you guys to highlight A, the recovery phase. All right, managing anxiety. Lily, can you please read the first and second paragraph on managing anxiety?
Anxiety is defined as a feeling of worry or uneasiness, often triggered by an event that is perceived as having an uncertain outcome. There are 4 levels of anxiety that range in degree from fleeting worried thoughts to a full-blown panic attack. The 4 levels of anxiety are outlined. An individual's level of anxiety has a direct influence on his or her ability to function effectively in an emergency situation. For example, a medical assistant with moderate anxiety is not able to notice details and think as clearly in emergency situations. However, emergency procedures that have been thoroughly learned through practice drills help the medical assistant decide what to do without having to think thoroughly through all the possibilities. In addition, practice drills tend to keep the medical assistant's anxiety levels from rising because he or she feels more confident when there is a structured plan to respond to in an emergency situation.
Very good. Okay, so on the first paragraph, I want you to highlight where it says anxiety is defined as a feeling of worry or uneasiness. And then highlight there are 4 levels of anxiety that range in degree from fleeting worried thoughts to a full-blown panic attack. Nancy, can you please read the next 2 paragraphs?
Severe anxiety can be problematic in an emergency situation because it tends to immobilize an individual and stimulate anxiety in others. Symptoms of severe anxiety include the following: hyperventilation, rapid pulse rate, excessive perspiration, and confused speech. In an emergency situation, a patient with severe anxiety may lose control of his or her emotions and cry or scream. This behavior can be minimized by the medical assistant giving the patient directions in a calm and reassuring voice. It may first be necessary to touch the patient to gain his or her attention, and then directions should be given in short sentences, speaking a little more slowly than usual. Instructing the patient to breathe deeply helps to reduce anxiety, but it is also important to direct the person exactly where to go if a dangerous area must be evacuated. If an emergency occurs in the workplace, the medical assistant should immediately focus on responding to the immediate situation, implementing established procedures, and helping others. Deep breaths will help you control the anxiety, which should be seen as normal response. Even in disasters that have caused enormous amounts of damage, lives have been saved and injury has been minimized when people have been able to stay reasonably calm and follow established emergency procedures.
All right. So I want you guys to highlight on the first paragraph where it says symptoms of severe anxiety include the following: hyperventilation, rapid pulse rate, excessive perspiration, and confused speech. Highlight a patient with severe anxiety may lose control of his or her emotions and cry or scream. All right, any questions? Okay, so on page 774, I want you guys to look really quick before we read our first case study, figure 22.6. The levels of rising anxiety. So it starts at the bottom, right? It has to rise. So mild anxiety, the body functions well in this state. The person may feel a little nervous. Does anyone know what that looks like for a patient? Do you have any ideas?
Wait, what was the question?
For mild anxiety, what do we think our patient may look like if they're experiencing mild anxiety? Sabrina said shaking. Maybe.
Yeah, you can. So, yeah, I was gonna say that.
Like the,
My sister has really bad anxiety, and sometimes when she's sitting there, she'll kind of like rock back and forth, and she doesn't even know that she's doing it. She'll rock back and forth. I sometimes have anxiety when I'm in public, and I'll just like look around a lot and just feel kind of nervous, and like I'll play with my hair, play with something. You know what I mean? To just keep myself
exactly. You're real
there.
fidgety.
Yeah.
Right. Yeah. Your body's just real fidgety. And most of the time, guys, your patient does not know they're doing it. Their body is relaying symptoms of how they feel on the inside. And a lot of times we don't feel what's going on the inside and we don't recognize what our body's doing in response to what we're feeling. Let's see. Yes. All right, very good. So you guys are right on the ball. A lot of patients, if they bite their nails, twirl their hair, yeah, I mean, and a lot of times you can look at your patients and see it, look at their hands, and not that it's a bad thing. It's just the body's response when we're going through that. That's part of a mild anxiety, right? Those are some of the symptoms, some of the signs that you may see your patient experience. Those are signs we need to pay attention to. Okay? If we just did a procedure on a patient and I see that they're doing this or they're, doing this or really fidgeting, I'm going to ask them, do you have any questions or concerns? I'm going to try to talk them into calming their concerns, easing them down so they're understanding what the instructions are and I know that they are safe, right? You have to be able to pay attention to the signs. All right. Sabrina, can you read moderate anxiety? Okay. Go ahead and just kind of start fidgeting in your room. Maybe play a little music. Okay, I'll text you in a minute.
I can't find it.
What? Page 774, figure 22.6. Moderate anxiety.
Oh, okay. I was looking at the paragraph. Alright, attention is restricted to a particular task or problem rather than an entire situation, called selective inattention. Still able to think fairly clearly, but focuses on only one thing at a time. Manifestations: sweating, rapid pulse and breathing, muscle tension, and possible stomach pain, frequent urination and/or diarrhea. Interventions: a calm manner is reassuring. Acknowledge that the patient appears anxious. Focus on one thing at a time. Encourage the patient to take a slow, deep breaths.
Very good. Okay, so have you ever experienced when you, and not that anyone has, but so for me, when I've been through really stressful situations, right, I get sick to my stomach. Like, I don't know, it's very weird, but some people do. So that's also a sign, right? Confusion, rapid pulse, or sweating. They can't sit still. All right, so that's what you would consider moderate anxiety. All right, let's read severe anxiety. Nancy, can you read severe anxiety?
Painful level of anxiety produces loss of abstract thinking and consumes almost all of the person's energy. The person cannot notice what is going on, and even if it is pointed out. Manifestations: crying, confused speech, dry mouth, sweating, rapid pulse and breathing, muscle tremors, increased muscle tension, elevated blood pressure. Interventions: provide a quiet area for the person to regain control. A calm manner is reassuring. Encourage the patient to take slow, deep breaths. Seek guidance from the physician if the patient is breathing faster than 22 to 24 breaths per minute.
Very good. Okay, so I do want you guys to highlight that first and second paragraph. All right, so if it's 22 to 24 breaths per minute, what does that mean that we are counting?
Can you say that one more time? I'm sorry.
No, you're good. If we're doing 22 to 24 breaths per minute, if that means what we need to be on watch, what does that mean that we're doing?
Isn't that called tachypnea or something like that? Tachypnea?
Yes, but it's a Lily, you're close. What's the name of that?
Respiration?
Yes, rise and fall, respirations. Very good.
Well, I mean, I know it's respirations, but when it's an abnormal
It,
increased respiration rate, that's what it's called, correct?
yes, correct. Yeah, you're correct. Okay, so again, why do we think we keep hearing the take slow, deep breaths? Why is that the one thing that we keep reading about? Any ideas?
I mean, it calms you.
It does.
You get a chance to actually breathe and get air in because you're hyperventilating. You're not getting air in. You're starting to freak out. It makes it worse.
That's right. When we assist in a patient or even people, right? When you assist in having and take slow, calm, deep breaths, it takes the focus off of what they're thinking and it puts it into place of taking slow, deep breaths. This is something new that they can control. That eases some of the worry, right? And we can kind of bring them back down to where we can talk to them, get them to talk to us, things like that. All right, very good. So that's severe anxiety. Yes, Natalie, and that's very common. I do that too. So one thing that you can do, right? Let's say your patient is like having some anxiety on getting an injection or maybe even getting on their blood draw. Okay. It's called the tapping method. If you tap for whatever reason, it calms the patient. And I think it kind of helps them focus. They feel something, right? And it's a calming mechanism. So yeah, you forget, like your body takes control in some of our normal functions that we do without thinking of it, right? Most of the time you are breathing without thinking of it. Okay, we'll stop doing that, Sabrina. Take a slow, deep breath. So the reason why I'm kind of taking a little pause is because as a medical assistant, you're going to have patients that either already have these type of conditions, right? They already have some anxiety, or maybe they have experienced something traumatic and they're coming to the doctor to help them learn how to move past this traumatic experience, okay? As a medical assistant, you have to recognize the signs and you have to know some things that you can do to help ease your patient, okay? Any questions on that? Okay. Panic, severe state of psychological stress. That's weird. It says stress, but I'm pretty sure it means stress. Person unable to focus or cope may focus on small details which are totally blown out of proportion. Manifestations, incoherent speech, ineffective communication, sweating, rapid pulse and breathing, muscle tremors, increased muscle tension, and elevated blood pressure. Interventions. The panic state usually subsides fairly quickly because the body cannot sustain it. Interventions are the same for severe anxiety. It may be necessary to make transportation arrangements for the patient. So in my 20 years, I've never had to do that. But you do need to know what to do. And if you are ever in doubt, right, like if you're just worried about your patient, to your provider. They will help you in knowing what to say, knowing what to do if we need to do anything. Okay? All right. Case study number 1, Julie Manning, who is sitting in the waiting room, receives a call on her cell phone. She speaks with the caller for a few moments and then rushes to the front desk window. She tells Beth Ann that she has to leave immediately because she has just learned that there is a fire at her son's school. Miss Manning speaks very quickly, but her story seems disconnected. It is also clear that she is breathing very rapidly and perspiring excessively. Okay, my medical assistants, what would you do? Have her take deep breaths. Now, so that is good, right? That's what we've been reading. But if you're Beth Ann and your patient just told you that, and you tell her to take deep breaths, what do we think she's going to do?
I don't think she's gonna
Do the
take it
opposite.
very well because
Right.
this is her son's school. This is her
That's
son.
right. That's right. So this is really good because Alicia, you did say, which is right, have her take deep breaths. But again, we got to be able to relate to our patient. We got to be able to empathize with her. So let's continue that. So have her take deep breaths. But what else could we tell her or do for her that will help her do just that? Take deep breaths. What are some things that we could offer? Right? Is there anything that we can offer to do for our patient?
If there's, we could ask if there's somebody to call for her
That's right. Is there
because
somebody we can call for you?
yeah,
Good. All right. What's something else? Is there anything else that we could offer? Okay, so Natalie, that's good, but I'm actually really glad you said that. So reassure her that emergency services will be there already. Now, that is correct. If there's a fire, if they're not already there, they're on their way. But as a mom, because not everybody may be a mom on here or even a parent, right? You may have a stepchild. Okay. So if you're not, there is something about when it comes to your child that is true. But if you say that to a patient, they may not care anything of what you just said, right? Because they're really concerned, right? Like if that was me, I would be freaking out.
I think as a parent at the moment, there's nobody that can actually protect your child. Like you just want to be the one to be there for them.
Yeah, you want to be the one to rescue that, right? And that's hard. It's hard. That it's just a hard situation if you have to be put, especially in this type of situation. So Natalie, you are correct. Reassure her that emergency services will be there. But this is one of those, it's not what you said, it's how you said it. So what is something that we could tell our patients other than just reassure her that emergency services will be there already?
I'm sorry, what was the question?
What was that, Nancy?
What did you say? What was your question?
So my question is, so Natalie made up a good point. She said reassure her that emergency services will be there. So that's correct. But this is one of these words is something that it's not what you said, it's how you said it. So what is a way that we could tell our patient without saying reassure her that emergency services will be there already? What is something that we could say or that we could do to help our patients based on that?
I don't know. Maybe something like, um, I understand you're concerned about your child, but we're also concerned about you driving in this, in this state or in this situation because, she's also obviously not going to be in a good state of mind right at that point.
That's right. Yeah, so that's some good points. So let me give you this scenario. If if I'm assisting in setting up the transportation for my patient to go to the local hospital, my patient is very upset and they're very scared and they're alone. what is something I could ask my patient?
Well, that's why I said earlier, if there was anybody we can call for her, so that way they can transport her, because I don't think it would be the right thing to let her get behind the wheel.
That's right. So that's right. So in this same instance, I'm going to do the same thing. Is there anybody that I can call for you? Okay, so let's go back to case study number 1. Is there anybody that I can call for you? Yes, that is on point. But one thing that we could do for our patient is that, what do you think that could be?
Well, let me ask this. I know in some places, the medical assistant themselves will transport that patient, but I would think it all depends on the job that you're at.
Correct. Yep. In some cases, it's the medical assistant. You may be part in making that 911 call, right?
Yeah.
Because you always have to call 911. You can't just call, like, your EMT area. You have to call 911. So you may be the person that makes that call. So we need to get information. You have to make sure you have all the information and you answer all the questions. And then you ask if there's anything that you can do to assist them in coming to get the patient, right? We need to make sure that our entryways are free, right? They have to bring in the gurney. You will be responsible for doing all that, or helping the one that is responsible, right? We always want to help our team members. So this case study is not an easy one, right? So we know we're seeing signs that it's not safe for her to drive. So we want to call a family member, right? We want to, who can we call so you're not by yourself, right? But we also want her to know that we know she's concerned, right? We know she's scared. We don't want her to leave because she's not in a safe position to drive. So this case study is kind of hard. This one's not easy. Now, one thing that you can do, right, if she's still really having a struggle time, like she's finally understanding that she needs to, let's sit down. Who can I call for you? I'm on the phone. I'm calling. One thing that you can do, or
Yeah.
offer her some water and sit down and recollect herself. Yeah, Nancy, what did you say?
I was about to say, offer her some water.
Yeah, offer some water. Just have her kind of sit for a minute, because we know she wants to go to her child, right? We just want to make sure she gets there safely.
Yes, ma'am.
So who can come get you? If it's a school, sometimes you might can call that school, right? Call that ISD, and they normally can provide you with information up to date on what's going on, and the process of how they're handling that situation. Because you have to remember, with schools, they have an emergency plan protocol, they have fire protocol, they have protocols for every single thing that can happen inside that facility. So if you call that ISD, or if you call your local, they will be able to provide you with a protocol, because it could also be that even if the mom wanted to, she's not going to be able to get to her kid, right? They're going to move them to a safe zone. And until they can collect that all students are safe, they may not even tell you where that is, right? So every school district is very different, but they all have a protocol. So this is a really good case study, I think, because it really kind of makes you think. And if you're not a parent, or you don't have if you're not a guardian of any kind, which is fine, it kind of gets your mind to think about, I may not be a parent or whatever in some case, but I know what I can do to offer to help my patient. All right, very good. Any questions on that?
No.
All right. Emergency preparedness in the medical office. I don't remember where I was at. So Nancy, will you please read that paragraph?
Large clinics and small medical offices alike may experience emergencies such as fires, floods, earthquakes, power outages, workplace violence, and a variety of other emergency situations. Emergency preparedness is the process of making plans to prevent, respond to, and recover from the emergency situation. To protect employees from fire and other emergencies and to prevent property loss, medical offices should develop emergency preparedness plans. Emergency preparedness plans, as stipulated by OSHA, must include an emergency action plan, EAP, and a fire prevention plan. These plans are discussed in more detail in the following section.
All right, very good. So, I just want you guys to highlight where it says emergency preparedness is the process of making plans to prevent, respond to, and recover from an emergency situation. Natalie, can you please read emergency action plan?
An emergency action plan, EAP, is a written document that describes the actions that employees should take to ensure their safety if a fire or other emergency situation occurs. The purpose of an EAP is to prevent fatalities, injuries, and property damage during an emergency situation. Almost all medical offices are required by OSHA to develop an EAP. The EAP must be in writing, be kept in the workplace, and be available for employee review. Before development of the EAP, an assessment must be performed by the medical office to determine the potential emergencies that could affect the office. Some emergencies may occur within the medical office. Examples include a fire, workplace violence, or a medical emergency. For example, patient having a heart attack. Other emergencies may arise from situations occurring outside the facility. Examples include a flood, tornado, and earthquake. The EAP should outline the actions that should be taken for each of the potential emergency situations identified by the office.
Very good. Okay, so I just want you to highlight in the first paragraph where it says Emergency Action Plan, EAP, is a written document that describes the action that employees should take to ensure their safety if a fire or other emergency situation occurs. Highlight EAP is to prevent fatalities, injuries, and property damage during an emergency situation. Okay. Sabrina, please read components of a emergency action plan and just read one.
There are 6 elements as required by OSHA that must be included in an EAP. These are listed and described in the following paragraphs. Other EAP elements that are recommended by OSHA but not required include a description of the alarm system to notify employees to evacuate, the site of an alternative communication center to be used in the event of a fire or explosion, and a secure location to store original or duplicate copies of essential records. The 6 elements required in an EAP are as follows. The preferred means of reporting fires and other emergencies. In the event of an emergency situation, it is important to report the situation and alert the employees immediately. Emergency situations such as fires can be dangerous levels very quickly, and a delay in summoning emergency responders and alerting employees may result in the loss of life and property. One or more of the following methods are typically used to report the emergency and or alert employees to the presence of the emergency situation. A. Dialing 911. This is a common and preferred method for reporting emergencies. B. Dialing an internal emergency phone number. If internal in-house numbers are used reporting emergencies, they should be posted on or near each phone. Internal emergency numbers are sometimes connected to an intercom system so that coded announcements may be made throughout the facility. For example, the facility may indicate a patient is having a heart attack by announcement of code blue, or that there is a fire in the facility by an announcing of code red. C. Activation of manual alarm system. OSHA requires that the employers provide an early warning system so the employees can safely escape the workplace. The most common means to alert employees and other building occupants are audible and visual alarms. In the offices with 10 or fewer employees, it is acceptable to use direct voice communication for alerting employees, provided that all employees can hear the voice alarm. OSHA requires that the alarms be distinctive and recognized by all employees as a signal to evacuate the workplace to begin implementing the emergency actions.
Very
So
good.
okay.
Yep, no, you're good. It's a lot. So that's why I was like, just do one. Okay. So on page 775, I want you to highlight that there are 6 elements as required by OSHA. And then I want you to highlight on number 1 where it says the preferred means of reporting fires and other emergencies. Highlight 1 or more of the following methods are typically used to report emergency and or alert employees in the presence of an emergency situation. A, highlight dialing 911. B, highlight dialing an interval emergency phone number. C, activation of an manual alarm system. And highlight in offices with 10 or fewer employees, it is acceptable to use direct voice communication for alerting employees, provide that all employees can hear the voice alarm. All right.
I think you went a little too fast for me, Miss Daniel.
Not a problem. I told y'all, say, Miss Daniels, I'm gonna need you to slow it down a little bit. All right. Where
This
did
is
I
what
lose?
I got. There are 6 elements as required by OSHA.
Yes.
Dial 911.
Okay. Where it says number 1, highlight the preferred means of reporting fires and other emergencies.
Okay.
And then highlight above dialing 911 where it says 1 or more of the following methods are typically used to report the and or alert employees to the presence of an emergency situation. And then A, highlight dialing 911. On B, highlight dialing an internal emergency phone number. C, highlight activation of a manual alarm system. And then in C, highlight where it says in offices with 10 or fewer employees, it is acceptable to use direct voice communication for alerting employees, provided that all employees can hear the voice alarm. All right. Number 2, emergency evacuation plan. Highlight those 3 words. An evacuation is a planned, systematic retreat of people to safety in emergency situation. According to OSHA, the emergency evacuation plan for the medical office must include the following 3 components. A, emergency evacuation procedures. Evacuation procedures consist of clear, step-by-step procedures for the rapid, efficient, and safe removal of individuals from a building during an emergency. Highlight, it is recommended that an emergency evacuation coordinator be assigned to take charge of and manage the evacuation procedures during an emergency. In high-rise buildings, the office evacuation procedures should coordinate with the building evacuation procedures. Evacuation procedures should include the following. Highlight the first and last bullet point. The conditions that would require evacuation of the area, the chain of command showing who can authorize an evacuation, the actions employees should take during the evacuation, for example, shutting windows, turning off equipment, closing doors. Procedures for evacuating individuals with disabilities or who do not speak English. B, type of evacuation. The type of evacuation ordered during an emergency depends on the type of emergency situation. Highlight, for example, the immediate and complete evacuation of a building to a safe area is typically required in the event of a large fire. On the other hand, a small fire in a wastebasket may require only a partial evacuation of employees from the immediate area. In some instances, the evacuation of occupants from the building may not be the best response. In the event of a tornado, for example, employees are typically required to evacuate to a safe part of the building, such as a designated shelter area. This is known as a shelter-in-place evacuation. The EAP should specify the type of evacuation recommended for each type of emergency identified in this plan. C, exit routes. An exit route is a continuous and unobstructed path of travel from any point within a workplace to a place of safety. Highlight, OSHA requires that specific guidelines be followed with respect to exit routes. Some of the guidelines, those that most affect the medical office, are as follows. Highlight, exit should be clearly marked and well lit. Highlight, exit routes must be at least 28 inches wide and at all points. Highlight, exit route should be unobstructed and free from clutter at all times. Highlight, exit signs should be posted. Highlight, exit doors must be free of decorations or signs. Highlight, doors that cannot be used to leave the facility should be clearly labeled not an exit. Highlight, an exit door must be unlocked from the inside. And highlight, an exit door must be open outward. Evacuation floor plan. Exit route should be clearly identified and marked on an evacuation floor plan, figure 22.7. It is recommended, if possible, that both a primary and a secondary exit route be identified on the floor plan. Highlight, a primary exit route is the quickest and easiest way to exit a building during an evacuation and is usually represented on the floor plan by a continuous solid red line with a directional arrow. A secondary exit route provides a secondary means of escape in the event that the primary route becomes blocked by smoke or fire. It is often represented by a continuous dashed blue line with a directional arrow on the evacuation floor plan. The floor plan of a multiple-story building should show the locations of stairways and elevators and must indicate that the stairs, not the elevators, should be used as the means of an exit in an emergency. Highlight, evacuation floor plans should be posted in multiple locations throughout the medical office, including each examining room, the waiting room, restrooms, the break room, and offices. Highlight, an evacuation floor plan should include the location of the following. Highlight each bullet point. Employees' current location, primary and secondary exit routes, manual fire alarm boxes, portable fire extinguishers, emergency exit doors, wheelchair accessible exits, shelter-in-place areas, and assembly areas. All right, before we read number 3, look at figure 22.7. So this is what they're talking about, right? And you're going to see these all throughout your office. You have to have one in every single office, every single exam room. Yep. And you might have not even seen them in a medical office, right? Let's say you worked at Walmart. You would see these in Walmart, right? You see the doors you can exit out. If you have elevators, can you use them in emergencies? Because in most cases you can't. You have to use a stairwell. All right, so it's just telling you, so the red line is your primary exit route. Your star is pictured like that's where you are. You see the blue line your wheelchair exits, your fire extinguishers, your fire alarms, and if a shelter in place is needed, where that would be. Okay. Any questions before I start number 3? All right. Procedures for employees who remain behind to perform critical operation before evacuations. Highlight those words. If necessary, some employees may be designated to stay behind briefly to operate fire extinguishers or to shut down electrical equipment or special equipment that could be damaged if left operating, or could create additional hazards to emergency responders. The EAP should identify each of these employees and describe in detail the procedure that he or she is to perform. An employee remaining behind must be capable of recognizing when to abandon the operation or task and evacuate to a safe area. Number 4, highlight procedures to account for all employees after an evacuation. The EAP should identify an assemble area for employees to meet after an evacuation. The assembly area should be a safe distance from the building and have enough space to accommodate all of the employees. Assembly areas typically include parking lots and other open areas from busy streets. The EAP should include a mechanism for accounting for all employees after an evacuation. The purpose of accounting for building occupants follow an evacuation is to help determine if someone is still in the building in need of a rescue. This can be accomplished by taking a head count or through the use of an employee roster checklist. A mechanism also needs to be established for accounting for non-employees such as patients and visitors, example, pharmaceutical company representatives. Highlight most offices designate the patient login sheet as means of accounting for patients in the event of an evacuation. The name and last known location of an individual not accounted for need to be relayed to an emergency official. It is important that the building occupants be instructed not to leave the assembly area until everyone has been accounted for and dismissed. Number 5, procedures for employees performing rescue or medical duties. Highlight, during an emergency situation, various rescue or medical duties may need to be performed by employees. These employees are often referred to as evacuation wardens. The type of duty varies depending on the emergency situation. The EAP should specify these duties, including the type of duty to be performed and the name of the employee who is to perform it. Each employee evacuation warden must be thoroughly trained in the duty he or she is to perform. Duties that may need to be performed by evacuation wardens during a fire are discussed later in this chapter and are outlined in Table 22.1. Number 6. The names or job titles of individuals who can be contacted for further information or explanation of duties under the plan. Lucy, hush. At times, may need additional information or further clarification of the duties to perform under the plan. The EAP should list the names or job titles of those individuals, both within and outside the facility, who can be contacted to provide this information. I know that's a lot. Any question? Okay, fire safety in the medical office. Alicia, can you please read that?
Fire is the most common type of emergency situation that occurs in the workplace. Each year, there are approximately 70,000 to 80,000 serious workplace fires in the United States that result in death of more than 200 workers and injure 5,000 more workers. It has been shown that approximately 85% of workplace fires as a result of human behavior, whereas only 15% are caused by catastrophic failure of equipment. Overall, fire is the third leading cause of accidental death in the United States. In addition to the human cause, a fire can also cause structural damage to the medical facility as well as the loss of valuable documents and information. There are numerous ways for fires to start in the medical office. Examples include overloaded electrical outlets, heat producing equipment that is too close to combustible materials, improper use of appliances, example coffee makers, microwave ovens, stoves, improper handling of storage of chemicals, cleaning supplies, and other combustible materials, and arson. If the medical office, I don't know why I always say that. If the medical office processes its own laundry, poorly managed washers and dryers can also cause fires, especially if the dryer is vented improperly or if the lint trap is not kept clean.
Very good. Okay, so in the second paragraph, I want you to highlight that there are numerous ways for fires to start in the medical office. Examples include overloaded electrical outlets, heat producing equipment that is too close to combustible materials, improper use of appliances, for example, coffee makers, microwave ovens, and stove. I hate that they put coffee makers down. That really makes me sad. Highlight improper handling and storage of chemicals, cleaning supplies, and other combustible materials, and arson. All right, elements of fire. A fire is a chemical reaction that involves the rapid burning of a fuel. Highlight a fire needs 3 elements to occur: a fuel source, an ignition source, heat, and oxygen. Once a fire has started, it will grow hotter and it will not stop until at least one of these elements has been removed. All right, fuel source. Jasmine, please read fuel source.
A fuel source consists of any flammable or combustible material. A flammable material catches fire easily, such as propane and gasoline, whereas a combustible material is any material that will burn, such as paper or wood. All flammable materials are combustible, but not all combustible materials are flammable. A tiny spark may cause a flammable material to ignite, but would not cause a combustible material to ignite. Many items can provide fuel for a fire, such as paper, cardboard, wood, plastic, fabric, and flammable liquids. Common examples of fuel sources found in the medical office include the following: patient medical records, furniture, drapes and rugs, office equipment, chemicals used for sterilization and disinfection, laboratory testing chemicals, and trash.
We'll go over it together. All right. So on fuel source, you're going to highlight a flammable material catches fire easily, whereas a combustible material is any material that will burn. Highlight many items can provide fuel for a fire, such as paper, cardboard, wood, plastic, fabric, and flammable liquids. Highlight common examples of fuel sources found in the medical office include the following, and highlight each bullet point. All right, Lily, please read ignition source, heat.
An ignition source provides the energy necessary to increase the temperature of the fuel source to a point at which it ignites. Once the fuel source has ignited, it produces heat. As long as enough fuel and oxygen are present, the heat generated by the fuel source will continue the combustion process. Examples of common ignition sources include the following: open flames, burning candles, faulty electrical equipment, hot surfaces, examination light, sparks, burning cigarette.
Very good. Okay, so highlight an ignition source provides the energy necessary to increase the temperature of the fuel, and highlight each of those bullet points. All right. Nancy, oxygen. Can you please read oxygen?
Here, around about a 21% oxygen content, and most fires only require an atmosphere of 16% to burn. Many medical offices store oxygen in their facilities to administer to patients if necessary. This stored oxygen is a safe gas as long as it is stored and used properly. Oxygen stored in the medical office is not flammable, nor will it explode. However, it greatly increases the combustion rate of a fire. If something catches fire, oxygen will make the flame hotter and cause it to burn faster and more vigorously. The result is that a fire involving oxygen can give the appearance of an explosion.
Very good. Okay, so just highlight that first sentence. All right, fire prevention plan. Natalie, please read fire prevention plan.
A fire prevention plan is a written document that identifies flammable and combustible materials stored in the workplace and ways to control workplace fire hazards. A fire prevention plan reduces the probability that a workplace fire will ignite or spread, which helps prevent injury or death, keeps the workplace safe, and helps to prevent financial losses at the medical office. Almost all medical offices are required by OSHA to develop a prevention plan. The fire prevention plan must be in writing, be kept in the workplace, and be available for employee review.
All right. Highlight a fire prevention plan is a written document that identifies flammable and combustion materials stored in the workplace and ways to control workplace fire hazards. Highlight reduces the probability that a workplace fire will ignite or spread, which helps prevent injury or death, keeps the workplace safe, and helps to prevent financial losses to the medical office. All right. Components of a fire prevention plan. And for the record, guys, I know this chapter really isn't fun, but it is something we have to go over because you may, and I pray nobody experiences, but you might, and you need to be able to know what to do. Because if I hear that one of my students didn't know what to do, I'm going to be very upset. Okay. Components of a fire prevention plan. 5 elements as required by OSHA must be included in a fire prevention plan. These are as follows. A list of all major fire hazards, including A, proper handling and storage of fire hazards, B, potentially ignition sources and controls, C, type of fire protection equipment necessary to control each fire hazard. 2, procedures to control accumulation of flammable and combustible waste materials. 3, procedures for regular maintenance of safeguards installed on heat-producing equipment to prevent accidental ignition of combustible materials. Name or job title of employees responsible for maintaining equipment to prevent or control ignition sources or fires. Name or job title of employees responsible for the control of the fuel source hazards. Methods of fire prevention for the medical office, which incorporate many of the elements listed above, are presented in box 22.1. Fire protection in the medical office. Fire protection involves the implementation of safety measures to reduce the unwanted effects of fire. The purpose of fire protection is to prevent the spread of fire from one area of a building to another, allow for safe exit of the building occupants, and prevent or reduce the amount of property damaged. Fire protection for an office building is specified by first code requirements and is the responsibility of the owner of the building. However, fire protection for the contents of the office is the responsibility of office staff. Some of the important safety measures employed in fire protection are listed and described in the next following paragraphs. Sprinkler systems. Sprinkler systems are one of the best measures available to extinguish a fire in its early stages. Highlight sprinkler systems are usually located at the ceiling level and use water to put out or slow the progress of a fire. Highlight sprinklers are activated by the buildup of heat in the fire area, which causes a glass component in the sprinkler head to melt or break, releasing water from the sprinkler. Highlight only those sprinklers closest to the fire area are activated, which reduces water damage to the contents of the building. For example, just 1 or 2 activated sprinklers may be able to quickly extinguish a fire that has just started in the office lavatory. Highlight most sprinkler systems include an alarm system that alerts both building occupants and emergency responders when sprinkler activation occurs. Many states require sprinkler systems in the commercial and office buildings. Some states that require sprinklers for larger office buildings do not require them for smaller office. For example, A provider's office that has been converted from a house. All right, fire doors. Highlight: a fire door is a fire-resistant door that is designed to prevent the spread of fire from one area of a building to another. Figure 22.8. Fire doors assist in the safe escape of occupants from a building during a fire and help to reduce property damage. In large office or freestanding clinic, fire doors are typically located at certain points in the corridors. Fire doors should never be propped open. Instead, they should be allowed to shut to their naturally closed position. Just highlight that first sentence. Fire resistant. No, it does not taste as good as regular bacon. It is good though. All right, fire resistant cabinets. Whenever possible, medical records should be stored in the fire resistant file cabinets. It is not better. Yeah.
It's completely, I think it's so good. It's better.
Nope. Yep, Jasmine, I'm with you. Regular bacon tastes better. All right, in the offices, use a physical system to back up computer files instead of a network or an internet system. The backup drive should be stored in a fire-resistant file cabinet or fire-resistant box type safe. It is always preferable to store a backup copy on the internet at another location. Fire alarms. That's not nice, Alicia. Natalie, you should listen to us. Yeah, but regular bacon can be less greasy as long as you drain the grease and plot it dry. Fire alarms.
Ms.
Fire
Dan,
alarm. What?
can I read?
You want to read?
Yes, ma'am.
Please.
Thank you. A fire alarm is a device that warns building occupants of the presence of a fire. Once a fire alarm has been activated, a loud noise and flashing lights are broadcasted to alert building occupants of a fire and to provide them with enough time to safely evacuate the building. The alarm also notifies the fire department so that the firefighters can quickly respond to the fire. Fire alarm pull stations. Fire alarm pull stations are frequently located in the corridors of buildings. It is important for employees to be trained in the proper activation of a fire alarm and what conditions necessitate activating the alarm. Smoke detectors. A smoke detector is a device that detects and automatically provides a warning of the presence of smoke. Smoke detectors laws vary by state in terms of how many must be in an office and where they must be located. In many buildings, smoke detectors are wired into the building security and fire alarm system. If the office has battery operated smoke detectors, these should be tested monthly by pressing the test button. Batteries should be changed every 6 months and the date should be noted on the detector.
All
Fire
right. Hold on a second, Nancy. So, do you remember when we went over OSHA and CLIA? Like, your office manager may assign you to be over that, and in that process, you have all these logs, right? You have your refrigerator logs, you have your supply logs, you have all these logs. This may be one thing that's on your list is your smoke detectors. You have to go around and do a monthly maintenance and make sure that all your fire extinguishers are up to code and their expiration date or when they need to be maintenance. Same thing for smoke detectors. You'll have a log of when the batteries were last changed and so on and so forth. So these are things that it may be part of your job description to include. All right, Nancy, thank you. Go ahead, sweetie.
Fire extinguisher is a portable device that discharges an agent designed to extinguish a fire. A common examples of extinguishing agents include dry chemicals, foam, carbon dioxide, and water. Portable fire extinguishers are considered a first line of defense in the early stages of a fire and have two primary functions: to control or extinguish a small fire that has just started, and to protect an evacuation route that a fire may block with smoke or burning materials. A fire extinguisher should never be used to fight a large fire that is out of control. Instead, the building occupants should evacuate the premises immediately and call the fire department. Fires are classified into 5 categories according to the type of fuel that is burned. For example, a Class A fire involves the burning of ordinary combustible materials. Fire extinguishers are marked with a label indicating the type of fire classification they are and designed to handle. New types of fire extinguishers are labeled with a pictogram illustrating the type of fuel that can be extinguished by the particular extinguisher. Older type of extinguishers are labeled with colored geometric shapes with letters designations. Table 22.2 lists and describes the 5 fire classifications along with the type of extinguisher by label that can be used to extinguish each class of fire. Most fire extinguishers are designed to handle more than one fire classification. For example, a multi-purpose fire extinguisher is labeled with the 3 pentagrams and is designed to extinguish Class A, B, and C fires. Most medical assistants have multi-purpose fire extinguishers in their facilities because this type of extinguisher can put out most type of fire extinguishers must be properly identified and readily accessible in an emergency situation. Fire code requirements specify the size, number, location, and type of fire extinguishers within the facility. These requirements are based on the protection level that is appropriate for the hazard class of the building and the types of fire most likely to occur in the facility. Fire extinguishers are mounted on brackets or installed in wall cabinets. See figure 22.11 and are usually located along normal paths of travel and near building exits. If a fire extinguisher is mounted in a room, it is placed near the door so that the fire does not get between an individual and an exit. There should always be a fire extinguisher within 50-foot travel distance of flammable liquids that are stored in the container. Fire extinguishers must be stored in their designated place at all times except during operation. Fire extinguishers must be properly maintained to ensure that they are safe to use and will operate properly when needed. Most medical offices use maintenance personnel and a certified fire extinguisher agency to inspect, maintain, and test their fire extinguishers on a regular basis, monthly and yearly. A durable tag is attached to each fire extinguisher to document each service check, including the date of the service and the signature of the individual performing the service. Small fires can often be put out quickly by an employer using a portable fire extinguisher, ending the threat of a major fire. To this safety, however, the employee must know how to properly operate a fire extinguisher. OSHA requires that any employee responsible for operating a portable fire extinguisher be thoroughly trained in the use of the fire extinguisher as well as hazards associated with fighting a fire. The acronym PASS is used to help remember the steps involved in operating a fire extinguisher. PASS. P, pull out the pin. A, aim the nozzle at the base of the fire. S, squeeze the handle. S, sweep the nozzle from side to side at the base of the fire. Procedure 22.1 outlines in more detail and the procedure for operating a fire extinguisher.
All right, very good. Okay, so really quickly, go to page 781. Under fire extinguishers, highlight the first sentence and highlight where it says to control and extinguish a small fire that has just started and to protect an evacuation route that a fire may block with smoke and burning materials. Highlight a fire extinguisher should never be used to fight a large fire that is out of control. On page 783, it would be, I guess it'd be considered the second paragraph. Highlight where it says fire code requirements specify the size, number, location, and type of fire extinguishers within a facility. Highlight fire extinguishers are mounted on brackets or installed in wall cabinets and are usually located along normal paths of travel and near building exits. Highlight if a fire extinguisher is mounted in a room, it is placed near the door so that the fire does not get between an individual and an exit. And then highlight where it says the acronym PASS is used to help remember the steps involved in operating a fire extinguisher Pull out the pin, aim the nozzle at the base of the fire, squeeze the handle, sweep the nozzle from side to side. All right. On table 22.2 on page 782, where it says Class A, highlight the words paper, wood, cloth, rubber, and many plastics. I know this is a lot, guys. I really...
Where was that, Miss?
On table 22.2 on page 782, where it says Class A, highlight the words paper, wood, cloth, rubber, and many plastics.
Got it.
Okay. All right. Any questions so far, ladies? We're almost done. You are doing great. All right. Let's see here. Jasmine, can you please read emergency response to a fire? And then we're going to read case study number 2 before we go to page 789.
It is important to respond immediately to a fire. Most fires start out small but can quickly increase in size and intensity and become life-threatening in just a matter of minutes. The heat, smoke, and toxic gases from a fire that is spreading are often more dangerous than the flames. The acronym RACE can be used to identify the basic steps to follow in responding to a fire. Race against fire. These steps are as follows. R. Rescue anyone in immediate danger of the fire. A. Activate the alarm. C. Confine the fire by closing doors and windows. E. Extinguish the fire or evacuate the area. If the fire is small, use a fire extinguisher to put the fire out. If the fire cannot be extinguished, evacuate the area. Procedure 22.2 presents a more detailed emergency plan for responding to a fire, incorporating the RACE response outlined here.
Okay, stop right there for me. All right, highlight the acronym RACE can be used to identify the basic steps to follow in responding to a fire. Race against fire. These steps are as follows. Rescue anyone in immediate danger of the fire. Activate the alarm. Confine the fire by closing doors and windows. And extinguish the fire or evacuate the area. All right, case study number 2. Bree Matthews is at the medical office for an evaluation of her diabetes. Beth Ann enters the examining room to measure Bree's vital sign. She notices that Bree is studying the fire extinguisher mounted on brackets near the door and turning the service tag over to read the information on it. Bree indicates that she needs to get a fire extinguisher for her home and wants to know the meaning of the 3 pictures on the extinguisher and why the extinguisher has a tag attached to it. Bree wants to know who is allowed to operate the fire extinguisher and how long the extinguisher lasts before it gets used up. Bree also wants to know why there are fire extinguishers in the office because she noticed that the office has sprinklers in the system. Or, I'm sorry, in the ceiling. Okay, so what would you do?
We can let her know that the reason that we have a fire extinguisher and the sprinklers is because, I mean, the sprinklers really only go off after it detects a certain amount of heat, and we can try to prevent them from going off by putting out like a small fire before it gets really big.
Okay. Very good. What else?
It probably falls under thing Alicia said, but it's just to explain to her the differences between why we use, when the sprinklers go off, because there's a different level of fires.
That's right. Yeah, we want to be able to control it, right? So yeah, that's good. All right.
And we highly want to recommend her to get a fire extinguisher for her home.
Yeah, I mean, you really want to be able to have one, but we definitely don't want to um, make her feel bad for not having one, right? Some people
No.
don't know they should, and some people may not have access to where they can. So, we don't want to make her feel bad. But yeah,
So I'm just like, if a patient ever mentions that, I think I would just encourage it. Like, I wouldn't be like, it's a
yeah,
must, you should, or why don't you have one? Just encourage it. That's a great idea. I think that would be,
yeah, yeah,
an
exactly. Especially, like, um, if your patient, let's say your patient loves to cook, right? Like I love to cook, my daughter loves to cook, but you better believe we have a fire extinguisher. So, it's things like that. I mean, you can just always recommend, if they love to cook, well, yeah, you know what? Then I think I agree. I think it'd be a good idea for you to get one. Yeah, very good. That one seems pretty easy, right? Compared to the last case study.
yes.
Yeah. All right. Very. So now let's turn over to page 789. All right. Employee training and education. Sabrina, are you where you can read that?
Yes.
Thank you.
Medical assistants must know what types of emergencies may occur in the medical office and what course of action they should take. OSHA requires that employees be provided with education and training on the EAP. The training should include the following: individual roles and responsibilities, threats, hazards, and protective actions, location and operation of manually activated pull stations and communication equipment, emergency response procedures, evacuation, shelter, and accountability procedures, location and use of common emergency equipment, emergency shutdown procedures. The EAP must be reviewed with each employee at the following times: when the initial plan is developed, when the new employees are hired, when the employee's responsibilities are or designated actions are under the plan change, whenever the plan is changed.
Very good. Okay. So I want you guys to highlight where it says OSHA requires that employees be provided with education and training on an EAP. The training should include the following. Highlight the first 7 bullet points. All right. Emergency practice drills. Alicia, go ahead and read that.
Sorry, my cat. Okay. Um, Once employees have reviewed and been trained in the EAP, it is important to hold emergency practice drills. The purpose of a practice drill is to provide employees with the opportunity to practice their assigned duty in a simulated emergency situation. This increases the probability that employees will perform their duties safely and effectively in the event of an actual disaster or serious emergency. Emergency practice drills are also provide the opportunity to evaluate the effectiveness of the EAP and determine any necessary changes or adjustments needed for improving performance. The two types of emergency practice drills, fire drills and disaster drills, are discussed in more detail in the following sections.
All right, very good. All right, so does everybody remember, emergency practice drills in school or maybe even in some places of employment?
Yes.
Right. And when we were younger, we looked forward to those, right? Because that gave us a chance to kind of get away from what we were having to do.
Oh, even at our jobs.
Yeah. Yeah. I was always happy when it was during history and we would do a practice drill. I was like, yes, I'm not a history fan. So yeah, so it's basically the same thing, right? But the only difference, guys, and the reason why this chapter is important is because you are now the teacher who had to instruct the students to safety, right? It's part of your responsibility to make sure that you know what to do, you can explain what to do, and in action, you can do what you need to do to help you, your staff members, and your patients to safety. So that's why, I mean, this chapter seems like blah, but guys, that's a big thing as a medical assistant, right? And it's not just fire or tornadoes. I mean, it is, but we have to know when to call 911, right? What we have to do. So, all right, any questions? All right, let's see. Jasmine, please read fire drills.
Fire drills may be required at specific intervals depending on the municipal or state laws for the type of building and insurance requirements. Fire drills may be announced or unannounced. They assist employees of a medical facility to review emergency escape routes and procedures to respond to a fire. Fire drills provide employees with the opportunity to become familiar with exit routes under non-threatening conditions. This increases the probability of an organized and smooth evacuation during an actual emergency.
Very good. Lily, please read disaster drills.
Disaster drills are usually more comprehensive than fire drills. Disaster drills often involve several community agencies depending on the severity of the disaster scenario that will be simulated. Disaster drills are time consuming, but they allow all participants to practice skills that would be needed in the event of a disaster. In addition, they allow organizations and communities to evaluate the effectiveness of their systems and identify potential weaknesses in the ability to respond to an actual disaster.
Very good. Nancy, please do me the honor of reading the medical assistant's role.
The medical assistant is an important team member in developing and implementing the EAP for healthcare setting and can also contribute to emergency preparedness in the community. He or she may make recommendations to supplement emergency equipment or facilities in the office, serve on a committee to review or revise the emergency plan, participate actively in all fire drills and disaster drills, and participate in the review of the effectiveness of any drill. In addition, the medical assistant must be prepared to provide emergency first aid or cardiopulmonary resuscitation, CPR, both in the workplace and in the community. In an actual disaster, medical assistant might assist in providing emergency first aid and conducting patient interviews, helping to calm victims, documenting services provided, and performing phlebotomy or other procedures as directed. The medical assistant should be aware of the community resource for emergency preparedness. The medical office may keep a list of local organizations with telephone numbers or other contact information in the medical areas. Emergency Medical Services 911, Poison Control Center, telephone numbers of local hospitals, telephone numbers of local and state health departments, telephone number for the state hazmat response team. Hazmat is an acronym constructed from hazardous materials. It refers to materials that pose a danger to health or the environment and for which protective clothing is required for cleanup. The medical assistant should also be aware of community disaster plans and community organizations that might assist in a disaster. The website of the State Emergency Medical Agency often includes help articles related to the disasters that occur most frequently in that state. It is helpful to develop a list of useful resources for the medical office and update it regularly.
Very good. Okay, so something that I did as a medical assistant may be a good idea for you in your medical office. So whether it was my duty or not, I had a list of my local hospital, the local ER, 911, the 2 nearest fire department stations that were close to my office, the health clinics, like the community health clinics and community health fairs that were going on. I always stayed on top of that because you may come in contact with that your patient just they need help resources, right? You know, and as a medical assistant, I felt that I could help them with that. So whether it was school supplies, vaccinations, um, you know, health fairs, things like that that I knew that were going on in the community, I kept a log on and I kept that up to date on a weekly basis. So I'm not saying that you need to do that, but I think it is a good idea because it helps you get involved in your community. And the more involved in your community as a medical assistant actually can really benefit your patients. Okay, ladies and gentlemen, or I'm sorry, no gentlemen, ladies, we are at our case study number 3. Jordan Mendels, 32 years of age, is at the medical office complaining of headaches, fatigue, and insomnia. Jordan tearfully relays that her brother's house burned down 2 weeks ago. Jordan is now concerned about a fire in her own home. She wants to know the best way to prevent that from happening and also wants to know if her family should hold fire drills. Jordan says that she knows she should get a fire extinguisher but doesn't know how to use one.
Again, I want to encourage the patient to go, that they should have, fire drills, that it is important.
Yeah, I mean, how many of us have gone through, a environmental traumatic experience, right? And like all of a sudden you have this over powerful sensation of what if this happens to me? How do I prepare? What do I do? So it's pretty common, right? And that's kind of what's going on with this case study. So that was very good, Nancy. Anything else?
As far as how to use it, I guess we could help them, as far as resources of where they can go to be able to learn how to use a fire extinguisher.
Yes. And in most cases, a lot of people don't know that just like so your local fire stations, right? You can drive up at any time and they'll check your blood pressure. They also will show you how to do a fire extinguisher and provide maybe some insight on where to get one and anything else that this patient may need. So a lot of people don't know that you can do that. I've recommended a lot of my patients, they will call me, their blood pressure is so high on their blood pressure machine and they're so concerned that I will tell them that if they don't have access to go to the local ER, like let's say it's 15 minutes away, but your fire station is 5 minutes away, go ahead and pull up to your local fire station, have them check your blood pressure, because if it is that high, what do you think they're going to do? Anybody?
Did you ask a question?
I did.
I'm sorry, I was talking. My daughters were talking to me.
That's okay.
I
That's
was
all
an
right.
example. Okay, don't look at me like that.
That's okay. That's all right. So if a patient goes to a fire station and their blood pressure is um, extremely high, what do you think that the fire station's going to do?
Oh, they're definitely probably calling an ambulance and have you escorted to the hospital.
Yeah, and in most cases, the fire station do have EMTs on hand, and they can go ahead and transport you. So
Yeah.
that's right. Most firefighters now they've been trained for both, so they are both a firefighter and an EMT or paramedic, whichever your county may call them. So very good. So those are just some options. But again, you may not know those things if you're not involved in your community, right? So that's why it's kind of important. I've always viewed that it's important to get involved in your community, right? Know your community's health clinics, right? Like I know that for Ellis County, we have what's called Hope Clinic, and they offer a huge variety of services, and not only for the insured, but for the non-insured. So I think it's very beneficial. All right. Any questions? Okay. So far up to date, I'm going to go through my paperwork here and I want to see if anybody is missing anything. because this is your last week to give it to me. All right, let's see here. Now, this does not include your Evolve assignments. This is just your worksheets and your study guides. It will still be your responsibility to look at Evolve and see if there's anything missing. All right, so let's see here. Most everybody's been really good about getting their stuff turned in, which is good. Not on here. Okay, Anna, if you can send me your admin paperwork, that would be great. And Natalie, I need chapter 17 and your admin paperwork. Natalie, I need chapter 14 study guide, and Jasmine, I need chapter 14 study guide. I think that's it. Most of you guys, all of you guys have done really good about getting your stuff turned in. Okay. So, recap for those that attended lecture this morning. Alicia, give me a recap.
Of what? Like the beginning?
Yes.
I have
You're feeling very lenient this week and very nice. So, for everyone who, if you have anything that you think that you should have a better grade on or you'd like a better grade on it, as long as you attend the lecture, she'll open 3 for you, but you have to be very specific on the ones that you want done so that way she can open them. And if you don't want to do that and you think your Evolve grades are good, you can do a 4-page essay about COVID-19 and how it relates to you and how it can make you a better medical assistant. Or you can make you can do a 4-page essay on something that you feel passionate about. Also, when we go to our clinics, make sure that you have your schedule and all your information and have your mask and everything that you need. You shouldn't go up there until about 8:25. Stay in your cars. Have your mask on before. You're going to take our temperature. When we get there, we'll sign in, sign out, do a signature. Did I miss anything?
I don't think so. I think that about covers it. Thank you. See, I knew you were paying attention, even if you had to start talking about turkey bacon. All right. Ends. Okay. Who in my live lecture this morning does not have access to a mask? Type your name in the chat box. And it's not a bad thing. I want to make sure that all my girls have what they need. Sabrina, yes. So that was going to be my next statement. Yes. So there is a mask that's included in your baggie. If you've already used that, which is fine, I will have mask in the clinic for you. But I just want to make sure, I mean, if you say that you don't have one, that's fine. You can have one in the clinic. I don't know about that, Sabrina. I'm just kidding. We'll see. Okay. Okay, not a problem. So what I'll do, I'll make sure that there is a box opened. I'll either have it on the counter in the clinic or I'll wait for you guys outside and have you one hand it to you as you walk in through the door. Okay, so let's do a recap of COVID. If you are showing symptoms of COVID-19 or you have been exposed, what do you do?
Stay home.
Quarantine, get tested.
Yeah.
That's right. Stay home. Send me a message. Miss Daniels, I think I got it. Okay. I'll help you with what you need to do next, but you do not come to clinic. Quarantine 14 days. Yes, ma'am. All right, very good. Okay, any questions about anything before we end this morning? Okay. I told you it's not as good. I knew it. Okay, so don't forget to send me your chapter 20 study guide results. I will let you guys know when this video is posted. And then we will have 1 o'clock lecture, which is our open floor. So again, if you want to participate in the extra stuff that I'm doing for you guys this week, I would make sure to attend.
I put your things in the bag.
What? Okay. All right. I will see you guys at 1 o'clock. And then don't forget stuff to me and let me know if you have any questions.